it's a very, very dangerous time, but it's also an opportunity for Americans to go back to our roots, which is freedom, which is basically listening to truth and basically starting to, take back what is really ours, which is our truth, freedom, and health. And Fauci's not about that. He serves the masters of Bill Gates, the Chan Zuckerbergs, the Clintons, the CDC, the WHO, and in fact, the Chinese. This is what we're seeing before in front of our eyes, is exporting Chinese model of governance, top down, controlling the last oasis of freedom, which is our human body. People like Fauci need to be indicted for a lot of serious scientific crimes. That's why when we put out this petition, Fire Fauci, I think close to 50,000 people have signed it in 48 hours. And at least we have close to 1,000 medical doctors from all over the world. Everyday people get this. In fact, the unfortunate handcuffed medical professionals get this. This is an opportunity, a huge opportunity, Christina. The real solution is for us to rethink how much governance and how much over respect we give to MDs who unfortunately know nothing about the immune system. They don't study that in medical college. If you look, Christina, at the typical MD, many of them go into wanting to become a doctor out of some noble service. But fundamentally, the medical school education is really a big pharma medical education where the doctor is really trained, if this, then this. And the then is typically a pharmaceutical drug or some harsh medical intervention. Now, if you look at someone like a Fauci and Birx, they're sort of at the top of their quote unquote game, which means they're highly embedded into the big pharma model of medical education and the big pharma model of what the solution is. And that solution is typically a direct line from this disease, find typically a virus or a bug, and then recommend a vaccine or some harsh chemical solution. And most of that has to do with profiting the very, very big pharma companies. And so if you look at someone like Fauci, he's a guy who architected the big lie that HIV is responsible for AIDS. And it's a much deeper discussion, but he built his entire career on that, not talking about the fact it's the suppression of the immune system. When people's immune system gets suppressed, you can react to all sorts of exogenous things coming in. So this gentleman, and by the way, he prides himself on connections with Hollywood and Elton John and all this. And I think there's a group trying to make him the sexiest man alive on people. But you're talking about a guy who's embedded into the deep state. And he's your typical example of the worst of the modern scientific establishment. In my letter to the president, which I sent on March 23rd, I said, look, we live in the era of personalized and precision medicine, which is an expertise of mine, which I get invited all over the world to talk about. What that means is one size does not fit all. You don't lock down everyone. That's what Fauci's model is. It's a medieval model of medicine. And so what we fundamentally have is the approach that we should be taking is taking the people who are truly immunocompromised, truly have COVID-19, fine, they should be isolated, boosted up with immunosupporting things like vitamin A, D, and C. Those of us who are well, we should be back to work. We should be running this economy. Okay, if you want to take something to support your immune system, do that, which should be the vitamin A, the D, etc. One of the two most disastrous things here are we're socially distancing people and hiding them. Go look at the research, a landmark study. When you isolate people, that is one of worse than the detriments from obesity, smoking, and heart disease. Social isolation actually leads to upregulation of inflammatory compounds in the body and down-regulation of antiviral compounds. So you're basically increasing the person for viral infection by the amount of stress you're causing them from social isolation. And separate from that, we're telling people not to go out in the sun, which is vitamin D. Vitamin D is an antimicrobial. So this is essentially a recipe for actually hurting people, not really supporting them, but all brought to you under the rubric, and media says it over and over again, social distancing, flatten the curve. And this is sort of the nonsensical science that Fauci is expounding, and it's what needs to be exposed, and really what we really need to talk about if we truly care about public health is building up people's immune system. But that's not what Fauci and company are concerned about. Their model is big ag, which dirty air, dirty water, dirty food. They want people to consume not food that's healthy for them. And then the solution is vaccine mandates. Think about what's going to happen a year from now. When you go to get your driver's license, Christina, where's your vaccine card? And Fauci's already talking about that.
Yes.
Can you go to a gym?
Oh, yes, he is.
This is about developing a police state. I hate to use these very harsh terms, but that is what we're talking about, control of the individual. It's a very, very dangerous time. but it's also an opportunity for Americans to go back to our roots, which is freedom, which is basically listening to truth and basically starting to, take back what is really ours, which is our truth, freedom, and health. And Fauci's not about that. He serves the masters of Bill Gates, the Chan Zuckerbergs, the Clintons, the CDC, the WHO, and in fact, the Chinese. This is what we're seeing before in front of our eyes is exporting Chinese model of governance, top down, controlling the last oasis of freedom, which is our human body. Look, the real solution, Christina, as any solution to any pathogen, we need to understand that the medical establishment, the pharmaceutical medical establishment for hundreds of years has built its entire foundation of always blaming a virus or a germ. Always. So when scurvy came around, remember scurvy when people's teeth would fall out and they had bleeding gums? Oh, it must be a virus. Well, it was deficiency in vitamin C 100 years later, when even people on the ground knew it. When pellagra came out, which was when people's skin and everything would get all dry, horribly dry, and like eczema, ultimate conditions. Oh, it must be the Italians who are coming over the ship. They're bringing some dirty germs, and we need to quarantine them. Well, it turned out it was a deficiency in niacin, so on. So what we're seeing here is the virus hunters, the bacterial hunters creating fear. So the real solution says, number one, is to recognize that the immune system is quite strong. We're actually a walking ecosystem of germs, 380 trillion viruses, 60 trillion bacteria among the 6 trillion cells. There's viruses all around us. The reality is a strong immune system always handles this beautifully. It's the weakened immune system. So all those masks and all this stuff, people didn't wear this for humanity, okay? The issue is, how do you beef up the immune system? As I wrote to the president, vitamin D. Vitamin D is an antimicrobial. Why do you think in many of these hot countries we don't hear any about this? Vitamin A, which is all from the rich leafy green, dark green vegetables and fruits. That supports your body to create keratin, cytokeratins through vitamin A, which protects your cells. So these are the two foundation pillars. Yet Fauci and Birx do not talk anything about that, because a V in vitamin is an anathema for their vaccines. And same with the V in vitamin C is an anathema for their ventilators. You see, it's ventilators and vaccines. Yeah. And this is big pharma. And these guys need to be fully exposed. And in my view, people like Fauci need to be indicted for a lot of serious scientific crimes. That's why when we put out this petition, Fire Fauci, I think close to 50,000 people have signed it in 48 hours. And at least we have close to 1,000 medical doctors from all over the world. Everyday people get this. In fact, the unfortunate handcuffed medical professionals get this. This is an opportunity, a huge opportunity, Christina. The real solution is for us to rethink how much governance and how much over-respect we give to MDs who unfortunately know nothing about the immune system. They don't study that in medical college.